Welcome to the CNA Basic Nursing Skills Test. There will be 70 questions with explained answers. Let's begin. Question 1. To obtain the most accurate patient weight, the nursing assistant should weigh the patient. A. Directly after a meal. B. With two different scales. C. 3-4 hours after reading. D. At the same time every day. Question 1 answer, D. At the same time every day. Question 1 explanation, weighing the patient at the same time every day will yield the most accurate results, as the patient is likely in similar circumstances. Question 2. A nursing assistant is instructed to take the oral temperature of a patient who just had a cold drink. The patient's temperature should be taken. A. 3-5 minutes after the drink was finished. B. 15 minutes after the drink was finished. C. Immediately. A cold drink should not affect the reading of most oral thermometers. D. 20-30 minutes after the drink was finished. Question 2 answer, B. 15 minutes after the drink was finished. Question 2 explanation, a delay of 15 minutes should be enough time for the oral cavity to return to a more accurate body temperature. Question 3. A nursing assistant is caring for a patient with MRSA and is wearing a gown and gloves whenever she provides the patient care. When she needs to go care for another patient, she should dispose of her gown and gloves. A. In the dirty utility room. B. In the hallway. C. In the current patient's room. D. In the next patient's room before touching that patient. Question 3 answer, C. In the current patient's room. Question 3 explanation, taking the gown and gloves off in the patient's room before leaving to care for another patient helps reduce the spread of infection to staff and other patients. Question 4. Another term for decubitus ulcer is A. Pressure sore. B. Perforation. C. Ulcerated cyst. D. Ulcerated tumor. Question 4 answer, A. Pressure sore. Question 4 explanation, the term pressure sore is actually a more accurate term to use than decubitus ulcer. The other options are incorrect. Question 5. Why is taking a resident's oral temperature the most common means of obtaining a reading? A. It is the only method residents will accept. B. It is the most cost-effective means of taking a temperature. C. It offers the most ease of access and least inconvenience to the resident. D. It is more accurate than other methods. Question 5 answer, C. It offers the most ease of access and least inconvenience to the resident. Question 5 explanation, ease of using this method makes it the most preferable. The other answer options are not necessarily true. Question 6. When transferring a resident from a wheelchair to stationary chair, the nursing assistant should stand A. In front of the wheelchair. B. To the right side of the wheelchair. C. Behind the wheelchair. D. To the left of the side of the wheelchair. Question 6 answer, A. In front of the wheelchair. Question 6 explanation. Standing in front of the wheelchair is the most ergonomic way for the nursing assistant to pivot a resident into a stationary chair. The other options are not as effective for allowing this. Question 7. Which of these could be considered neglectful when assisting a resident with showering? A. Respecting the fact that bathing and showering can be a scary activity for residents and assuring them you will help them through the process. B. Being patient and calm and explaining what you are going to do before you do it. C. Leaving the resident alone so they are motivated to care for themselves. D. Being sensitive to water temperature and testing it before beginning the procedure. Question 7 answer, C. Leaving the resident alone so they are motivated to care for themselves. Question 7 explanation, residents left alone in the shower could slip and fall. Leaving a resident alone is considered neglect. All of the other options show care for the patient and her rights. Question 8. A resident in your care is suffering chest pains. Which of these is not a direction to follow? A. Offer support and reassurance. B. Talk and act in a calm manner. C. Have the resident take small sips of water and place them in a downright position. D. Call for help immediately. Question 8. Answer C. Have the resident take small sips of water and place them in a downright position. Question 8. Explanation. Patients suffering chest pain should not have water or foods until they can be assessed by other members of the healthcare team. A prone position is not appropriate for chest pains. All of the other options are important in the treatment of your resident. Question 9. All of these are ways to prevent pressure sores except A. Changing soiled sheets quickly. B. Changing positions regularly. C. Providing extra blankets. D. Avoiding wrinkles in sheets. Question 9. Answer C. Providing extra blankets.